Well, we're going to get started. Thank you so much for joining us. We are going to have several sessions, several information sessions on our health plan options and premiums between now and October 16th. The health plan insurance has an effective date of January 1, 2018. This was something that was recommended, and we took advantage of. This was recommended by the insurance committee, so it was a great opportunity that we took advantage of so that we could have enough time to communicate with everybody any of the changes. Again, open enrollment, if you are going to change your health insurance plan, open enrollment is October 16th through November 16th. And via email, we will send out to all employees the calendar of where open enrollment will be. So there will be a day dedicated to each campus and department, and then of course there'll be a day for everybody. You can attend any of the open enrollment sessions, whatever is most convenient for you. We're just trying to make it as convenient as possible for everybody, so we are having it at each location. But the specific date for your campus or your building will be sent out via email and will be available on the Employee Benefits website. I hope everybody has a presentation in front of them. What we have here is the last option that was the option that was approved by the board that was presented at the last meeting on August 31st. What we have here is a comparison of what the current plan is. So our current plan is running through December 2017. The new plan will start January 1 and it will go through December 31st, 2018. So again, our current plan, as you can see, we have three options, which is the basic plan with a deductible of $750, the high plan with a deductible of $250, or the HDHP plan with a deductible of $1,300. Within each plan, there's different tiers based on the needs, whether you're requesting coverage for employee only, employee spouse, employee and children, or employee family. What I'm going to do is I'm going to take you through the first line, which is employee only, because that is where the majority of our employees are classified. So again, the majority of our employees in the district have health insurance coverage for just themselves. In the current plan, the employee-only contribution was $0. It was a free plan. The district's contribution was $439.95. On January 1, if you select to stay on the employee-only plan, the deductible will remain the same at $750. The employee premium will be $156.89. The district contribution remained the same. On August 31st, the board approved a stipend for $156.89, which means that this plan here would still be free for the employee. So again, the plan will show a cost. However, the stipend will offset the cost for employee only. Are there any questions? The same format or process applies to each of the different plans, but I just want to make sure you understand, since the majority of our employees are on employee only, I really want to make sure that we walk you through from what the change is, what the stipend means, why the chart will show a cost. So again, for employee only, the January 1 through December 31st, 2018 plan shows a contribution of $156.89. However, you will also receive a stipend of $156.89. The chart that you are looking at, the values are on a monthly basis. Payroll happens twice a month. So when you look at this and you're trying to evaluate by pay period, please divide by 2. So again, this is a monthly chart, but if you're looking at it by pay period, please divide by 2. So for employee only, you'll see a stipend of about $78. And you'll see a deduction of health insurance costs of $78 approximately per pay period, but you'll also see a stipend for the same amount. So it'll be a net zero impact on to the employee. Now the rest of the tiers There were changes in the employee's portion of the contribution to have a plan for employee spouse, employee children, or employee family. Same process applies. This was the rate that was in our current plan. This is the rate that's being proposed for our new plan, for our new plan year. And applying the stipend of $156.89, this would be the net monthly change per employee. This, where it says option B, monthly change with stipend, this is what it would cost, or what the cost would be reduced by on a monthly basis. So for example, employee spouse, the contribution was $465.85. The new plan will be a contribution of $651.74. Oh, y'all can't see my cursor? Oh, well, let me fix that. I'm so sorry.
I knew you were pointing.
Yes, and let me fix that. Now you'll be able to see my cursor. There we go. I am so sorry. Actually, this is a lot clearer for me to read as well. Again, employee and spouse. The contribution in the current plan year is $465.65. The contribution for the new plan year will be $651.74. This is an increase of $186.09, or after the stipend, a monthly change of $29.20. So again, if you are currently on the employee spouse basic plan, you already contribute to the plan. There is an increase for the cost of this plan, but with offering a stipend to employees, you will see a net increase of $29.20 per month. The high plan and the HDHP plan have the least number of our employees that participate in those plans. But the high plan has a lower deductible, which means it does have a higher employee contribution cost. But again, these options are available so that the employee can choose what health insurance plan would best fit their needs or their and their family's needs. On the HDHP plan, this is also a plan that is free to the employee. This plan is regulated by the IRS. It has a deductible. It had a deductible of $1,300. Now IRS has changed the deductible to $1,350. So there is a change in the deductible for this plan. However, it is regulated by IRS. Now again, this plan was free to employees. The cost for employee only would be $156.89. After the stipend, as you can see, this would be free for the employees. Now, on employee and children, for a deductible of $1,300, the monthly cost was $173.60. For a $1,350 deductible, the cost will be $254.95. But after applying the stipend of $156, employees who are on the HDHP plan, employee and children, will see a reduction in their expenses of $75.10 per month. So again, we've lined up the tiers to reflect a sustainable plan. And after the stipend, this is the change that the employee will see per month. Now, the stipend does begin January of 2018, just like the health insurance plan. The health insurance plan would be effective January 1 of 2016. Oh, I said 2016, 2018. I'm so sorry. Of 2018. And if you will not be making any changes to your health insurance plan, whether it be that you're on the basic, high, or HDHP plan, and you're going to stay in the same tier, if you will not be making any changes, you do not have to go to the open enrollment. But if you will be making changes, the open enrollment period opens on the 16th of October and closes November 16th. We cannot open it after that day. So it's very critical that if there are going to be any changes, that they happen during the open enrollment period. Yes, sir. Yes, sir. The stipends are part of your taxable income on your W-2. How is it listed on the paycheck? Oh, regular income. It ends up falling on box number 1 on your W-2. On the paycheck? Yes, it's considered regular income. It will be titled Return to Work Stipend. This is a stipend that is being offered to all employees, and in order to offer it to all employees, it's called a Return to Work Stipend. Any other questions? There's more information, but I really want to make sure that everybody feels comfortable with the information in order for them to make the best decision that would benefit, again, your needs or your family's needs in the health insurance coverage. Are there any questions? Yes, sir. The $78. Oh, the one, yes, the stipend. If you want to calculate this table by pay period, yes, please divide by 2.
Okay, and then when it shows the stipend, we're not actually, it's going to take it out of our paycheck, or no? And then it's going to put it back into our paycheck? Or how's that going to?
Great question. On your paycheck, on your pay stub, you will see your contract amount for your salary, and then you will see your stipend amount. So per pay period, it would be around $78. Now, when you look at your deductions, you will see a deduction for health insurance for that same amount. And I say that same amount if you have employee only. If you have employee only, it would be for that same amount. So the net of the stipend less the deduction of the health insurance plan would be a 0 impact on your payroll check.
Okay, so then basically the stipend is just showing like for you guys, right, just to show that you get the stipend, and it's not really affecting our paycheck, correct?
It will reflect on your paycheck and it will reflect on your W-2, but so will the cost of the health insurance plan reflect on your W-2 as well. But it is a separate line on your paycheck. It is from a different funding source. That's why it is a separate line. Any other questions? If you do, we can go back to it. But again, the plan is for January 1 through December 31st, 2018. The plan will begin in January, and so will the stipend. This chart just simply takes out the prior year information so that you only have current year information, or I'm sorry, the new year information. So plan year 2018, which is the one that is effective January 1, 2018, these are the costs for each tiers within each of your options. This is your stipend, so this will be your net cost to have one of the health insurance plans. Again, most of our employees are employee only, so for employee only, you would have a no-cost plan after you see the stipend in your paycheck and the deduction for the health insurance cost. Employees who do not have coverage with the district will also receive the stipend. Now I'm going to hand it over to Paul so that he can explain the different plan options that we have.
Okay, so what I want to do is go through, first of all, what I want to do is get my glasses. So I can see. Okay, much better. Is go over, Yanakani talked primarily about the cost of the plan. And this information is also on the slide that we're looking at right now. But the cost of the plan is one component of a choice that you make when you decide whether you want to, what plan you want to choose in 2018. But every year we go through an explanation of how your plan works and go through information about the basic components of your plan. It's important to understand the basic components of your plan in order to say, for me and my family, which one is the best choice for me. So I'm going to start with, is my cursor? Yeah. I'm going to start with the basic plan and just go through sort of information that you should understand about the basic plan. It's going to be the same type of information on the high plan, on the high deductible health plan, but in order to understand how your plan works, we'll talk about the basic plan because that's the plan most of you are covered under. So you have an individual deductible of $750. So that means not all services that are covered under your plan are subject to deductible. So you may not satisfy your deductible in the course of a plan year because you could get other services that don't apply to deductible, that don't hit your deductible. But your deductible on your basic plan is $750, and that's in-network. So we always talk about in-network benefits as opposed to out-of-network benefits. Out-of-network benefit, your deductible is $1,000. So you have two deductibles. You have an in-network deductible and you have an out-of-network deductible. We're going to talk a little bit about staying in network, what to do to stay in network, and the benefits of that. But understand, if you want to satisfy one deductible only, then stay in network and you'll have your $750 deductible. If you go out of network, then you'll have the $750 in-network benefit and the $1,000 out-of-network benefit. You also have your family deductible. So you have, on the in-network side, you have a $1,500 family deductible. So that means two people satisfy their deductible in your family, and the deductible satisfied for the family. So if you only have two people covered under your plan, you and your spouse, for example, then you'll each have your $750. If you have a third person or a fourth person covered under your plan, only two of those people need to satisfy the deductible, then the whole family's deductible is satisfied. And that concept goes through the out-of-network deductible and then also the out-of-pocket maximums too. So you'll see your out-of-pocket maximum in-network is $6,450. So that means when you utilize your plan and you satisfy your deductible, after your deductible is satisfied, your plan pays in-network at 80%. You pay 20%. That 20 accumulates throughout the course of the calendar year, and if it hits 6450, then your plan starts to pay at 100%. Most of you don't ever hit your out-of-pocket maximum either, because at 20%, it's a hard for you. You have to get a lot of services in the course of a year for that out-of-pocket max to be met. But if it does, then you're covered at 100% for that plan year. Your deductible and your out-of-pocket maximums recalc or reset every plan year. So starting this year, your plan renewal date moved from 9/1 to 1/1. 1/1 is your plan renewal date now. 1/1 is also when all of your deductibles and your out-of-pockets recalc or reset. That was done on purpose because it synced those two things up. Okay? So the other thing to remember is you have the $6,450 out-of-pocket max in network for individual, $10,000 out-of-pocket max for family in network. Your out-of-network doesn't have an out-of-pocket maximum, so it never goes to 100%. It will always pay at the out-of-network benefit, which for your plan, as we keep going down here, in-network benefit is 80%, out-of-network benefit is 60%. Okay? Now, that means if you go out of network, you'll always pay the 60%. It will never go out of network to 100%. All right? But it will in network. These are all things to remember as you decide, am I going to stay in network? It's in your best interest for your own out-of-pocket expenses to stay in network. You also have co-pays. So you have an individual co-pay, a primary care co-pay of $30 or a specialist co-pay of $50. That means if you see family practice, pediatrician, OBGYN, internal med, those doctors that do your primary care, you have a $30 copay. If you see a specialist, a dermatologist, a cardiologist, something that's a specialty, you have a $50 copay. You also have a $50 copay on emergency room. The thing to remember about the structure of your plan is you have many services, not many, some services that are subject to a copay, and then the rest of that is paid at 100%. You have laboratory services, and we'll talk a little bit more about those as we go, that are paid at 100%. You have wellness services that are paid at 100%. So over the course of the year, if you only have office visits that have copays, or you only have wellness services that are paid at 100%, or in those office visits you only go to those in-network preferred labs, you may never touch your deductible. People ask me that all the time. I've been to the doctor 4 times this year, but my deductible's not satisfied. No, because those services don't go to deductible. Only services, hospital, ER, some radiology, those are the services that go to deductible. Okay, so you may never reach your deductible over the course of the year, yet you're still using the plan. Okay? prescription drugs, you have a really good prescription drug program. Your copays for prescription drugs are the same across all of your plans, $0 for generic. If you go to H-E-B, Walmart, CVS, or any of the major retailers that are maybe in San Antonio, Eagle Pass, Uvalde, like Target or Walgreens, those are all in-network for you. So if you go to those in-network pharmacies, you get generic medication, you're going to pay a $0 copay. You have a formulary brand, which is the lower cost brand medication copay of $35, a non-formulary, which is the higher cost brand medications of $50. You have a mail order generic of $15. You have that's for the 90-day supply. You have for generic for formulary you have $70, and for non-formulary you have a $100 copay. Okay, so that's the nitty-gritty of how your plan works, and it's the same concept on all of your plans, your basic plan, your high plan. Basic differences between the basic and high plan is you have a lower deductible on the high plan, $250 versus $750, and your benefit is paid at 85% in network versus 80% in network on the high plan. But essentially, you're paying a lower deductible and you're getting a better benefit if you go to the high plan. But you have to decide, is it worth the additional money that you're going to spend in order to be on that plan, which is all of that information that's up here. Okay, so there's a lot here. I'm going to stop there because I just went through a whole lot about how your plan works. Is there any questions about that information? I'm going to go through in a little more detail some more stuff, but I want to stop there because this is all like the nitty-gritty of how your plan works. Yeah. The things to remember about the HSA plan. Number one is if you don't use the plan very often, the risk that you take is there's no benefit paid on the HSA plan until the deductible is satisfied. So I think that's what your point was. True. You mean to meet the deductible? It could be one serious condition, but what I always tell people is, and we're going to go into more detail on the HSA plan, is if you don't use the plan that much, or if you use the plan a whole lot, meaning you have a chronic condition and you meet your deductible every year, the HSA plan might be a good option for you. But the risk is if you choose the HSA plan and you think year over year, I don't use the plan, and I understand that nothing's covered under the HSA plan, including copays for ER, copays for doctors, or copays for prescription. Prescriptions aren't covered under the HSA plan until the deductible is satisfied. The only thing that's covered is wellness. But you can say to yourself, well, heck, we're going to talk a little bit about the HSA contribution the district makes, and then you evaluate, is that a good deal for me because I don't think I'm going to use the plan that much, and I'm going to pay lower out of my payroll deduction, plus I'm going to get a contribution to an HSA from the district. Is that the right move for me? And the thing to think about is if I do need to use the plan and I do have that illness or that accident that cost me $1,350, do I have the ability to write a check for $1,350 in the short term? Because I'm not going to get any coverage for anything until after that $1,350 is satisfied. On the basic plan and the high plans, you have deductibles, but you have other services that are paid at 100%, like your labs, your generic medications, your office visit, just the copay. So those you're going to get coverage for even before your deductible is satisfied. On the HSA plan, you're not. So it's a strategy type decision. Yeah. Other questions? You can use your HSA card for well, immunizations would be covered at 100% as wellness. So those would be covered at 100%, yeah. Other questions? I'm going to keep going because the rest of the presentation goes into a lot more of the detail. This is just an overview of the wellness calendar and some communication materials that I think are included in the packet. But I'm going to keep going here. So this is just a little more information about how your plan works. One of the things to keep in mind is the district's plan is owned by the district. It's not owned by TML. The district owns the plan. It's self-funded, so TML administers it on your behalf, but we don't own it. We don't take the risk on it. The district does. So it's in your best interest to manage the plan according to the things that we've talked about from a personal, out-of-pocket perspective and also from a plan perspective, okay? So managing your healthcare costs benefits you. It also benefits your plan. We talked a little bit about the deductible not applying to services paid at 100%. Your labs, your office visit copays, those services do not apply to your deductible. If you get just those services, wellness, labs, your prescription, they don't apply to your deductible. So you could have multiple services throughout the course of the year that do not apply to your deductible. So you're getting health care, but you're not applying any money to satisfying your deductible. Co-insurance maximums accumulate after the deductible is satisfied. So that means you have your $750 basic plan deductible. After that, plan pays $80, you pay $20. That $20 accumulates to the out-of-pocket maximum that we talked about before. Stay in network is probably one of the two biggest things we can talk about as far as you managing your plan to cost effectively. In network, you have access to the United Healthcare Provider Network. TML has an alliance relationship with United Healthcare that gives you access nationwide, coast to coast, to the entire United Healthcare network. So any network that's in United Healthcare Provider Network is in network for you, okay? So if you go out of town or something comes up and you need to get care, maybe you're on vacation over the summer and you're going to be there for several weeks and something comes up, you can still call TML and say, I'm in Sheboygan, Wisconsin. I need to see a United Healthcare contracted provider. They can look one up for you in Sheboygan, Wisconsin. And you can go to that doctor and make sure you're staying in network. It's coast to coast. It's as big a provider network as there is in the country. So it benefits you because your cost is lower. You get 80% coverage in network, 60% coverage out of network. So you want to stay in network for your benefit. The plan also is your plan. You own it. The plan's cost is also less in network because United Healthcare has negotiated fees with the doctors and hospitals and labs and x-ray providers that you see, and they're lower than what doctors would charge otherwise, and they're contractually obligated to agree to that amount as payment in full. So you're not going to get balance billed any amount other than your 20% on those in-network. So I've talked a little bit about the United Healthcare Choice Plus network, and we've already talked about your deductibles. Yeah, the $250 versus $750, and then 85 versus 80, and your out-of-pocket max is the same. Okay, so that's a little bit of a repeat of what we talked about, but it doesn't hurt to reiterate that stuff. Routine care benefits is the second way that you can most cost-effectively manage your plan. Also benefits you as well. You have your routine wellness visit covered at 100% in network. Make sure you stay in network. It's covered at 100% for your annual physical. That benefits you because people many times may have early onset of a condition that is asymptomatic, so you don't even know it's there until you go get your mammogram or your colonoscopy or your blood work or whatever testing is appropriate for your age and gender. We have a mammogram bus out front. We've had it there for 2 days. We've gotten good response. So people are out there responding to that. And it's the whole point for you is detect those conditions early. Get them treated or have the peace of mind of knowing I'm good to go. I'll see you next year. If something does come up, get it treated early, as non-invasively as possible, and then know you have peace of mind of knowing I don't have anything out there that's looming that I don't know about because all this stuff, much of it is asymptomatic. It's also good for your plan because if you just let things go. We're talking about the mammograms. If you are developing breast cancer and you don't know about it and you don't get it treated and it all of a sudden becomes an issue 5 years down the road, now you've got a very expensive treatment, and it's very invasive on you personally. So we encourage stay in network and get your annual physical every year. You have preferred labs. LabCorp and CPL are your in-network labs. Several years ago, we had Quest as in-network. That hasn't been in-network for several years, so keep that in mind. I reiterate that every time I talk to you guys. Quest is no good. Quit Quest. Only LabCorp and CPL. That's how I remember it. Quit Quest. That's right. There are notification requirements under your plan. Some services require that your doctor call TML and provide notification that you're going to get those services. Here's a list right here of some of those services. ER admissions. If you're admitted, if you go to the ER and you're admitted, then your doctor needs to contact TML for prior authorization within 48 hours, 2 business days, okay? Also for scheduled admissions, pregnancy, transplant services, morbid obesity, and there's a list of services that require prior authorization on your plan document. If you have one of those services, you're required to make sure that prior authorization happened. You can't do it because it's clinical information being exchanged between your doctor and TML's clinical staff. But it's important for you to remember you have a 50% reduction in benefits if that doesn't happen. So it's on you as a benefit reduction if it doesn't happen. And we would like to make sure that people understand that. Most of the time it happens on its own because all insurance companies require this, and hospitals and other providers are aware a lot of services that they render are going to need prior authorization. And they don't want to only get paid 50%. They want to get paid 100% of what their allowable is. But sometimes it falls through the cracks, and it's important for you to understand that you should make sure that it happens before you have services rendered. Okay? Prescription, we talked about that. You guys have access to the OptumRx Pharmacy Benefit Manager. Our OptumRx is another United Healthcare company. It's one of the 2 biggest pharmacy companies in the country. Again, providers that are in network across the country are in the OptumRx network. So HEB, Walmart, CVS, Walgreens, Target, all those large retailers are in network for OptumRx. And this is where you go to get your generic, your brand, or your non-best brand or your non-formulary brand. So keep in mind that your best bet is, if you can, take generic because you have a $0 out of pocket. It's good for your plan too because your plan cost for generic is lower than brand. And by and large across the plan, you guys use generic about 80 to 85% of the time. So that's good. It shows that $0 copay is working as an incentive to get you to use brand if you can use brand. Okay? And then there's a couple other RX copay for 90-day supply and the mail order also for generic. So we talk about generic. We reviewed the copays on the other brand medication, but we talk about generic because 80 to 85% of you are using generic. So we want to make sure you understand the benefit on generic medication. You have specialty biotech medications. There's a $150 copay on specialty biotech. Specialty biotech medications are medications that are very expensive, and they treat very serious conditions like rheumatoid arthritis, multiple sclerosis, various forms of cancer. So if you're on one of these medications, you have the $150 copay, but you have an out-of-pocket maximum of $1,450 per year for that as well. So it maxes out at $1,450. A reminder about generic, another way that we want to steer you to generic is if you're taking a brand medication and it has a generic alternative available, you're going to pay the cost differential between the brand and the generic. Okay? If you're taking a brand medication, I'll say it again because it's a little confusing. If you're taking a brand medication that has a generic alternative available, the way your plan reads and works, you pay the cost differential between the brand and the generic in addition to the brand copay. So that's a good incentive for everyone to say, if I can take generic, I'm going to take generic because I have a $0 copay on that. If you take a brand medication that doesn't have a generic alternative available, because not all of them do, then you're still paying the brand copay only. You're not paying the cost differential. Okay? Specialty biotech does require prior authorization on the pharmacy side. So we talked about prior authorization on the medical. There's also specialty biotech prior authorization on the pharmacy. We talked a little bit about the high deductible health plan, and you asked a question about that. We do have that option. There's not a lot of enrollment in the high deductible health plan, but a couple things to remember are high deductible health plan is an IRS regulated plan. They set the rules. The IRS sets the rules as far as what the deductible minimums and maximums and what the out-of-pocket minimum and maximums are. But the district contributes $41.48 a month to an HSA account if you participate in the high deductible health plan. Remember, the high deductible health plan had a deductible of $1,350, or will as of 1/1. And we talked about nothing's covered except wellness benefits until that $1,350 is met. After the $1,350 is met, then if you stay in network, it's an 80% benefit. Out of network is 60. So it's the same benefit percentage as the other plan, as the basic plan, but nothing's covered until that deductible's satisfied. So you say, why would I do that? Well, number one, if you don't use the plan that much, it's a lower payroll deduction for you, costs you less, and you also get the $41.48 into an HSA. The $41.48 accumulates through the course of the year, and it's your money. It's not the district's money anymore, it's your money. You keep that money. And so you can use that in the event that you say, okay, well, I did have to go to the doctor twice. Well, if I go to the doctor twice, I'm not getting a $30 copay out of pocket. I'm getting the full cost of what the doctor's charging under his United Healthcare contract. So I'm paying that. But I can use my HSA card to pay for that doctor visit. So it's a gamble, no question, but you can think of it in terms of what's best for you. And I personally am covered under the high deductible health plan with TML. I know Yanniconi's covered under the high deductible health plan here at the district. So you have to make that decision based on what's best for you. If you don't think you'll use the plan and you want to say, okay, I have the ability to write a check for that deductible in the event that I have a relatively high cost claim, and so I'm going to be willing to take that chance. I'm going to take that risk. Or if you don't, then you probably shouldn't take that risk. So it's your decision, but you can use that HSA money on multiple things: out-of-pocket expenses, prescription, dental, vision, and so it's a choice that you make. There's also the alternate plan for those of you who are declining coverage that covers a very limited number of benefits, and I'm getting the high sign from Lauda that I need to move on, so I'm going to go through that pretty quick. Out-of-pocket maximum we've talked about. In-network is $6,450 individual on the basic and high plan, $6,450 on the $10,000 on the family on the basic and high plan, and $12,900 on the HSA plan. You do not have an out-of-pocket maximum on the out-of-network. This is just a quick blurb about TML. You have access to professional health coaches that can help you with any kind of healthy living question or issue that you want to address. Quit smoking, lose weight, eat healthy, start exercising. That's a service that's available to you as covered individuals under the district's plan. You don't get charged anything extra for that. It's a resource that's available to you. And we have refrigerator magnets out there that have the 800 number. When we get to the open enrollment period, you'll need your Social Security number for all covered individuals that are covered under your plan when you're adding anybody. Anyone who has dependents covered under their plan will need to know every year if those dependents do or do not have other coverage with say, a spouse's plan. And then also, we may ask you to complete a prior protected health information authorization form where you can give access to somebody other than yourself to your protected health information. If you get something from TML, please be sure and open it. It might be a check. We've had people get a check, put it aside in the drawer. They never cashed it. Then Yanniconi or Lauda is calling them and saying, hey, TML sent you a check. Why didn't you cash it? It's still showing up as uncashed. So open that correspondence. It could be an explanation of benefits. Read the explanation of benefits, understand it, or it could be something from a professional health coach that we're trying to give you information on that's important to your health. TML also has a website. It's actually www.iebp.org. I want to correct that when we're done here. And that's access to all your information online under your plan. You can ask a question to customer service. You can do a provider search for in-network providers. You can look at all your explanations of benefits. You can do everything online once you create that username and password. It's very easy, and once you kind of get into the flow, it's easy to get around. So keep that in mind. And that is all that we have for today.